And Mary Beth, welcome, welcome.
Good morning.
Good morning. Mary Beth, I don't know a lot about your background, but I am so appreciative of your willingness to come and talk. My understanding is you're an RN and that you wanted to come and chat with us a little bit about, um, keeping us up to date and what we should be looking for and, some signs and symptoms and just raising our awareness and our level of education about the novel COVID-19 pandemic that we have going on around us.
Well, just a quick summary. I'm an old nurse. I graduated in 1970 from a hospital school of nursing. I went to college after that. So I work now for Kaiser as a telephone triage nurse. Those who have Kaiser will be very familiar with the consulting nurse service. And I also do a lot of training with other nurses and doctors, especially around technology at home, which is very handy right now. Um, and about the beginning of February, no, actually more like the end of February, my intention was to move to Paris until the end of the summer. And of course, that didn't happen. And I went back to working a lot more than I usually do. And um, because of the governor's proclamation about the emergency, all of our regular hours and whatever were completely blown away. So we all ended up working very long days, and 90% of our calls, if not more, were about the COVID. The good thing I want to tell you all is I can give you statistics about what's happening. But the reality of it is that not all of our calls are about COVID anymore. And not all of our queues are 3 hours like they were a few weeks ago. We're really thrilled to get ordinary questions about lacerations and other things. I do see a change, and it's wonderful to see. Um, I also presume that most of the people I'm talking to are sheltering or mostly sheltering. And I would like to start by actually jumping off of the previous presentation to say that staying at home is a very difficult thing and it has emotional complications for everybody. I presume that by now everyone has figured out, and if they don't, they can email me and I will share my email too. Um, that there's a variety of museums from all over the world that are opening all of their collections. Shakespeare is available directly from England. There are many educational resources that are online that are free now. And I've been sharing those with some of my patients because they're bored and scared at home. So we can share those later. Um, and if any of you are on Facebook, I cannot strongly enough recommend a page that you can join called View from My Window. And someone started this and is going to make a book out of it. You're allowed to participate once. You get to show the view out of your window. And I go to this page every day and it makes me so happy. Oh, wow, look at this person in Rio de Janeiro. And, it's just wonderful to see all the people in the world, most of whom are coping with staying at home. And it's really a great resource. So, um, moving on to the medical stuff, um, the symptom list has been revised. All of what I'm telling you pretty much is in PDFs that will be made available to you later. Um, the revised list of symptoms from the CDC as of yesterday include cough, shortness of breath, or difficulty breathing. And of course, if you have pre existing conditions that cause those things, it becomes a little more complicated. So I would advise a worsening cough, a different cough, um, fever, but not everyone has a fever, chills, shaking chills, muscle pain, headache, sore throat, and loss of taste or smell. Now, At Kaiser, if you have one or two of those, you're pretty much getting a test. This is a huge revision from a few weeks ago when we were only able to test seriously ill people. And I think everyone's heard there's a lot of asymptomatic people out there, usually young people, who can easily share this virus with us and who do not present with any symptoms. It frustrates me when I see the news and they're running temperature things across people's heads. That's not the only criteria. So I would say that everyone has to make their own decision about their level of reentry into society based on their age, their general health, whatever it is that is going on with them. But for me, I do essential things. I'm not going to do things like going bowling or having my nails done. I don't do that normally, but some of the less essential things are not going to be part of my life. I will continue to maintain a physical distance from people. 6 foot is frankly not enough, but 6 foot is better than 1 foot. And we are extremely lucky here on Bainbridge Island because it's quite possible to take walks, especially in the off hours where you don't encounter anyone, where you can have your mask around your neck or in your pocket, and you can walk freely with your dog or by yourself and get fresh air and exercise, and you don't have to worry. Seattle, not so much. Does anybody at this point have questions about symptoms? I don't hear you. Let me see what's going on.
You don't hear me mostly because I had my microphone
Oh,
muted.
you were
If
mute.
anybody
Oh,
does if anybody does have a question about symptoms, go ahead and unmute yourself at this point. You can feel free to ask Mary Beth a question.
okay. I'm going to move along to masks. Who's wearing masks? Who's not wearing masks? Um, and does anyone have questions about masks? Well, the main point of masks is to keep whatever you have from everybody else. It It really, unless you're wearing an N95 mask that you've only worn a few times, is not any kind of guarantee. And most people wearing masks really can't seal them properly to their faces. I think we're seeing the pictures of the healthcare workers with embedded marks in their face from wearing them. Generally, we're walking along the street, we're wearing cloth masks or other kinds of masks. There is value. One value is that it offers some protection, just like the flu vaccine doesn't offer 100%. Um, and it prevents anything that you might have from being shared with anybody else. And if you happen to have seasonal allergies like me, or you have a cold or a cough, you pretty much will be treated like you have the plague on the street, and you really don't need that. So masks are optional, of course. There are some regulations about where you have to make masks or wear masks, and I suspect those will be lifted soon. But they're reassuring to other people and they offer you some protection. I have more information available about wearing masks and kinds of masks. There are also a lot of questions about whether objects coming into your house, your groceries, your shoes, your clothing, are an issue. Starting with clothing, not a problem unless you've been directly next to somebody who is ill or appears to be ill, or you've been outside in a group setting for an extended period of time. I don't change my clothes or shower, but you need to make a decision about that. It's about small droplets and they don't typically land on clothing. There's a discussion that shoes might be more of a problem than clothing. If you can leave your shoes at the door, that might be more practical. Um, you don't really need to worry about your hair and you don't need to do special laundry or anything about that. But you do have to think about when you go grocery shopping. And grocery shopping, if you can get somebody else to do it for you, that's nice, but how do you know what health habits they had? Um, so if you do your grocery shopping, I've noticed that locally TNC and Safeway have been taking really good precautions. And that's really much better than I saw in the city, and it's very important. I would say one thing you need to be careful about in TNC, though, is if you use the restroom. This is not new. This is not about coronavirus, but more than a year ago, there were several studies out of Harvard and other reputable places saying that hand dryers in the restroom simply blow whatever it is on your hands back out at you and the next person. So, how do you know how carefully somebody washed their hands before they used the hand dryer? It's better to use the paper towels. But otherwise, I am really impressed with both the people who are working in the grocery stores and the people who are setting up the guidelines. And we are luckier than most. Does anybody have any questions about grocery shopping right now? Most
I
people,
do.
yeah.
Mary Beth. I wonder if you could let us know. My children go and get my groceries for me, and they drop them outside the door of the apartment building here, and then I pick up the paper bags and bring them upstairs to my apartment. Um, do I need to do anything more than that with them? Do I have to wipe them all down? What you know?
Well, there are very conflicting studies. I looked all over for some handouts about this before the meeting, and the reality of it is, say your children bought you a can of beans. Who put it on the shelf? Who handled it when it was moved from the provider, and so forth? So we really don't know. Something I read that was just the easiest and the best was there's a variety of times where people believe the virus survives, um, starting with the most hard object, like a can or a piece of glass, that survives the longest. But it also survives on cardboard and paper. Well, the hard objects are the easiest to clean, but we all don't have a lot of sanitizer and so forth. So, what I read was try to separate your groceries. If they arrive and they're not separated, just put on a pair of gloves or do the separation and then wash your hands well. Leave them in bags if they're non perishable for 2 to 3 days, and any coronavirus on them will die. If you take it to 3 days, it means cardboard cans, just about anything. Now, fresh things, there's controversy about whether you need to use soap and water on them. I do use soap and water on hard vegetables, but I don't clean lettuce, for instance, with soap and water. I just rinse it with water. And also, you can rotate things. If you have eggs, you don't have to watch each egg. You can just rotate them, and after 3 days, they should be relatively safe. Does that answer your question well enough, or? Can't hear you, but I
Yes,
assume you're
all right. Yeah,
saying
that
okay,
works well.
okay.
Thank you.
Yeah, but that's a real
What
controversial
about the
area.
paper? What about the paper bags?
Well, I treat them as contaminated, so once I touch them, I wash my hand well, and then I leave them. I have what I'm calling the haul of groceries. It has 3 or 4 bags of groceries in a in an area where I don't have to touch them for a few days, and then sometimes if I'm not sure, I write on them with a pen or something as to when I can touch them. But the bag, yeah, because who handled the bag? And if you're there, you can see if the person packing has gloves on, but you also don't know if they contaminated themselves with gloves on. So that's you have to assume they're dirty.
I don't. It's not necessary, is it, to keep the paper bag with the ingredients inside outside on the porch or
No,
in
no,
the hallway or whatever?
I just put them in the hall. People put them on the porch for convenience, but it doesn't make any difference where you put them. It's a matter of time. And the
Okay,
risk is really actually quite low, but it is present. So we can take any precaution we can.
great. Thank you.
Sure. Numbers and testing. This is really interesting. We are very lucky here in that we have very, very low numbers. We've only had 2 deaths, and we, I'm looking for the document where here it is. There's an interactive tracker, which will be in the documents I sent in. But if you want to go to it on your computer, it's at cdc.gov/covid-tracker/index.html. It's more of a what's going on in the whole United States. But
I'm putting that up in the chat right
yeah,
now.
our numbers in Washington State as of last night were 13,842 cases. That is staggering. Now, that's all cases, the light ones, the heavy ones, and 156 cases have been confirmed in the last 2 days. And so COVID is still with us, no matter what political rules we have. If we are older or have health conditions, we need to take precautions. That's Washington State. There have been 786 deaths in Washington State. Now let's talk about closer to home. COVID testing in Kitsap County as of yesterday, 150 positive tests so far. Again, the gravity or intensity of how sick these people are, we don't know. Negative tests, I absolutely love this. 3,296 negative tests against those 150 positive tests in Kitsap County, and 2 deaths in this county. So we're really lucky until the tourists return. But we're not out of the woods, and we should take some precautions. But this is very important to know that only 2%, 2.3% of the population in Washington State has even been tested. So those silent people could be out there. And we have to be careful. And I noticed there's a very strong attitude of protection for everybody on the island. And it's wonderful to see. Although I had an interesting experience yesterday, I wanted to take pictures and put them on Facebook for my friends that are positive about this beautiful place that I live. And I went looking for a water view, and I stopped my car, took out my camera, and was met with really hostile stares because I clearly must be a tourist if I brought up my camera. And that was funny, but I also found it quite reassuring. I was also wearing a mask. Um, so 1 million people or more have had COVID in the United States. And most people have not tested. 2.3% of the population in Washington don't have the national statistics. Now let's talk about our friends across the water. This is the same date frame. They don't mention how many negative tests, but they have had 6,054 positive tests and 427 deaths to date. That's pretty scary. And they're just across that ferry. And when we start opening up our businesses, those people will be coming. People asked some questions about testing. Almost all tests require a physician's order. If you have or think you have any of the symptoms, please call your doctor. You most likely will end up talking to a nurse. If you're a Kaiser patient, you'll be talking to a consulting nurse anytime you call about. We manage the tests and results and the questions, and if you need to see a doctor. Other facilities handle it differently. but I was told about a new test site at the Kitsap Fairgrounds this morning. I don't know anything about it. The link was sent to me, and it will be in the documents I have. They had it open and then they had it closed, and I don't know what's going on with it right now, and I didn't have time to check. But there is a hotline in Washington State about testing. It's at 800-525-0127.
Could you say that one more time?
Sure, 800-525-0127. And I expect you'll have to sit down with a cup of coffee if you're going to be dealing with that. But hand washing, I think this has been maximally covered, but I'll tell you what it looks like when you see a nurse, regardless of COVID, in the restroom. And you might want to adopt some of these nursing habits. I back in or open the door with my elbow or a cloth. I assume the people coming in and out of the restroom do not have the hand washing habits I have. So I don't, one of the dirtiest places are literally the handles and the faucets. Everybody gets upset about the toilets and whatever. No, it's the surfaces we touch with our hands. When I turn on the faucet, I do it with a paper towel. I carry some paper towels in my purse just for this purpose. And if you've wondered why baskets have started showing up near the door, and this started some time ago, nurses will also open the door with a paper towel that they've dried their hands with before exiting. And then, people were throwing it on the floor. That's why baskets started showing up. So adopting these nursing habits gives you an extra degree of precaution, and it won't hurt anything. I don't know what specific questions you might have, and I'm happy to answer any of them. And as I said, there's information that I've sent out to you about all kinds of topics. Is there anything anybody wants to know more about?
I have a question. I'm Lynn. I work with Island Volunteer Caregivers. I'm curious, I know Kaiser does a lot of things for their Kaiser patients. Do you know if there are any other resources for other people to get the telephone triage nursing that you do? Is there some other access for them?
Almost every insurance company has this service, so like Blue Cross and so forth. I have colleagues who work for insurance companies doing this. Virginia Mason and Swedish have consulting lines. Several hospitals do. I don't know if Harrison's consulting line is still available. Kaiser runs it a little differently. We are the door, basically, to everything. A lot of our clinics are closed, and so they call us. We talk to them, and Kaiser also has at least 4 physicians or mid-levels sitting with us. Well, it's virtual sitting now. Most of us are remote, but I can pick up the phone and say, Dr. Jones, I've been speaking to Mrs. Smith and I'm concerned about such and such. So we do it a little different than most, but there are certainly resources. Unfortunately, these resources are stretched really thin, and there's state lines and so forth, but you can't get through. Kaiser will only talk to Kaiser patients. However, if you called Kaiser with an emergency situation, like you were having trouble breathing or a heart attack or something really serious, the receptionists are obligated to put it through to the nurses. But if you start telling us you have a cold, we're going to tell you to call your doctor. I also think that most of you are well familiar with the resource for helicopter transport. It's a very rare situation, but the cost is minimal, and we're all seniors now. I don't think that this is going to be an issue with COVID, but I've found, unfortunately, that we get callers who tell us symptoms of things like heart attacks and strokes, and then refuse to go into the emergency room. And that's really scary. When you go to the emergency room, if you have to go to the emergency room, each and every one of us is working really hard to protect you, put you in a separate place and so forth. But if you have a serious life-threatening condition, don't be stupid. That's just, don't do it. I can't tell you how many times I beg people to do this. And worse yet, if you actually talk to a medical professional and you tell them, that you have crushing chest pain, shortness of breath, or whatever, they're legally obligated to call 911 if you refuse. So don't get mad at that nurse who calls 911. It's a legal obligation. But you need to take care of yourself no matter what.
Lynn, again, you mentioned the helicopter service, and I believe this is correct that if you have to be transported by helicopter, and you do not have the helicopter insurance, it's very expensive. But I believe the helicopter insurance is pretty reasonable. And I don't have the information where you get that, but do you have
I
it?
actually do, Sheila. I just put it up in the chat. One
Okay.
resource. I know there's several. So I only am aware of one that's called Life Flight.
Right.
There are other resources, and I'd love to hear those names. I used to be a paramedic. You can expect, if you have to get on a helicopter, that it is a minimum $10,000 to get on a helicopter if you do not have insurance. And what they show in the membership online that I was just surfing around is that for 1 year's membership, to fly to have a membership with Life Flight is $69 for 1 year.
We just did that for a family. It's less than 100 or around 100.
Mm-hmm.
And every year at least this used to be true, the Bainbridge Fire Department has a sale on this where they are out and they're making a little bit of money on it. Yeah, and here's an interesting statistic. I used to live in Seattle, 2.5 miles from downtown. I was told that it would take more time to call an ambulance and get that ambulance to bring me to the emergency room than it would for a helicopter to take off from Bainbridge Island and land at Harborview. So these are reserved for extreme emergencies. We're not going to take you for any reason other than that, but we're all going to have an emergency someday, and it's certainly worth the price of doing that. And now's a good time to start thinking about it.
Is the test up here at by Rite Aid still going?
The testing at Rite Aid?
Well, it's Harrison, I think. It's Harrison and Virginia Mason.
I get a little involved only in my own provider. I wasn't aware of it. I heard that many pharmacies.
No, not the pharmacy, Mary Beth. I'm sorry, I meant up in that area on Bainbridge Island, that Virginia Mason.
Oh, the Virginia Mason that's across the street from the hardware store in the back there.
Yep. That was supposed to be a testing site.
I don't know about that, but I can tell you that my husband has a physician in the city, and he needed to have another kind of test, and he called Virginia Mason, and they were willing to do the test for him and send the results to his physician. So I think you'd have to check with them. But there have been pharmacies, the ones that practitioners in them, Bartell's and Walgreens, different providers like Walgreens, they're Swedish people, and Bartell's are Kaiser people, have nurse practitioners who provide care for non-serious issues. And for a while, those people were doing the testing, but at least at Kaiser, we pulled them because we needed them inside. So I can't answer that. I'm sorry.
So I am just looking on the website, and on Bainbridge, up at the Hildebrand complex there, Harrison is offering, it says call to confirm before visit. So COVID testing site.
they're probably there for screening you because tests are limited. It's gone from only the most sick to anybody with a symptom. So if you have a symptom of concern and you talk to someone, there's a good chance you'll get a test these days. But I think officially it might require an order from a doctor or a mid-level, and that's why you might have to call first.
Right. Yeah. I
Yeah.
think that's true. Yes.
Could I ask a question?
Sure.
This is Betsy Lytle Smith. Couple of questions. One is, how accurate is the testing? I mean, I've heard all kinds of various things about, that it's only like 50% accurate and
Yeah.
that kind of thing. Do you know?
I've heard this too, and it depends on where they got the test, and they're keeping this very close to their belt. They're not telling you, if you ask Kaiser, where'd your test come from? They will not tell you. I can assume it's not 100% accurate. I have heard of people who have been retested positively. Another thing is, it must be that if you're only a little bit sick, sometimes it doesn't trigger the test. Because I can see patients' records where they've had a test 2 weeks ago and then they're positive. Well, that doesn't mean they had COVID 2 weeks ago. It means they could have, or they could have picked it up in that window. The test is less important. The test is for public health tracking. So it doesn't affect your care. We're going to treat your symptoms. And there's no magic drug that's for COVID anyways, despite what you hear on the television. There's a number of drugs that they are trying for the symptoms of COVID. But it's a virus and it's mutating. All viruses mutate. So we're hearing about symptoms we didn't have before, and we're treating them with, in some cases, experimental drugs, and some tried and rejected, like malarial drugs. And they're moving on to new things, and there's lots of studies. I wouldn't
Okay.
assume it would be 100%. Yeah.
Thank you. One other quick question about the masks. Well, two questions. One is, why weren't we told to wear masks from the very beginning? Do you think it's because there weren't any masks, or it was just a big mistake? And secondly, does it really matter if you have a cloth or a paper mask? I mean, I have some paper masks left over from being at the doctor's office, the kind they give you when you just walk in there if you have a cold or a cough. And can you reuse those several times?
Well, you shouldn't reuse the paper ones because you don't know what got on the outside of them. And the cloth ones can be washed and should be washed. So there's a big divide. There's the paper and cloth and t-shirt and spandex masks, all those things. They're one class. And then there's literally, you have to go to the N95 or N100 masks, which ceased to be available beginning in January. And, people are finding them in hardware stores because they're particular masks. I have one that is left from when we had the forest fires. So those really do filter, but if you happen to buy the kind without the little vent on it, you actually will become short of breath because the carbon dioxide does not go out. That's why you see medical workers either wearing the N95 with the filter or cloth. They're not perfect. You also see these plastic barrier things on people in the grocery store. But, air gets in all around, but that's more for splashing. They're really not intended for the grocery store workers. They're intended for the medical staff where somebody might cough directly on them or other body fluids.
Thank you.
Better wear a paper or a cloth one than none at all at this point, I think.
Thanks.
Yeah.
I think that's interesting about cloths. We got 2-ply cloth masks that we bought that had a carbon or a charcoal filter that went inside. And one of my concerns about it is that it's created such a barrier, 3 layers that you end up breathing in and out of, that the air is more likely to push out the sides than it is to go through the mask itself.
Anybody who has even the slightest bit of compromise because they have a cold, because they're asthmatic like me, I put the N95 mask on and I'm good for about 5 minutes until I feel like I'm breathless. Most of us don't have that anyways, so it's probably better for us to be wearing the cloth or paper mask in a non-clinical situation.
Wow, interesting.
I have a question about the masks.
Yeah.
Um, and it has to do with adding the paper coffee filters to a cloth mask. Do you feel that that is a positive addition or useless?
Remember that the mask is to keep you from the rest of the community. And so if you had COVID or something, it might make a marginal difference. But vacuum cleaner filters that people have been using, even though they say they're HEPA filters, coffee filters, they're not going to do very much. They may remember the size of the particle is what matters. So think about what goes through your coffee filter. You produce a colored liquid, some of that goes through it. So coffee filter's the least safe. Vacuum cleaner masks are really not true HEPA. And, some people have gotten them from vacuum cleaners that have filters, not a used one, of course. So I don't think it adds much.
Thank you.
Yeah.
Another question I have with regards to symptoms is the fact that my fatigue level is higher than it has ever been. Has fatigue and lack of energy been identified as a symptom?
It's technically listed as a symptom, but we tend to only regard it if it's associated with another symptom because people are having emotional overlay from this. They are fatigued because they're not sleeping well at night. They might be fatigued because they have other issues. And I mean, if you asked everybody in Bainbridge, are you fatigued? Probably more than half of the people would admit to being fatigued. It could be age, it could be anything. So fatigue alone is not a symptom, but fatigue plus change in smell might be something that if you called me, I'd get you a test. But it definitely is on the list.
Thank you.
Mm-hmm.
Yeah, I think, just speaking personally and both for the connections I have around me, just to Richard, was that I think everybody is feeling a little fatigue. I like to think of it is that you kind of have a super highway of energy or bandwidth for every day. And that's what we're used to using to get things done, to get through our day. And that's the bandwidth we're used to. And in this time, it's there's a part of our bandwidth or our superhighway of energy that is being used up with a background awareness that we're living through a pandemic. And for some people, it is over half their energy every day is just taken by the concerns or frustrations or worries about the fact that every day we're dealing with this pandemic. And on top of that, they're trying to get done what they normally get done, which I think for a lot of people is unrealistic. And so I think that there's really a fair acknowledgement that it's really appropriate to give ourselves a break and give yourself a little bit more space during this time. I know during the early parts of this, there were lots of people posting about, like, what am I going to do with all this time I have off? I'm going to learn a new language. I'm going to take on a new skill, start a new business. And nobody has been through this before, and we're all making it up as we go along. And it does take up time and energy and personal resources. And the more sort of compassion we can have for ourselves during this time, I think the better served we're going to be in the long run.
Boy, that was beautifully stated. There's one more thing I forgot to mention. We're pulling out of the winter, but there's still a little bit of it. And the story is that this will resurge in the winter. So maybe you need to think about this. Don't go to Costco and buy an entire cart of toilet paper or anything, but just make sure you have a little bit a backstock of things that you found difficult to get. For me, that's been cleaning products and flour. And, don't buy 100 of them. Just there's no reason to panic. But the other thing that's extremely important to do, and do not take it casually, is it's still cold and flu season. The flu still kills people, especially people with what we call comorbidities, other things going on like asthma, COPD, being a senior. Please, when the flu vaccine becomes available for the next year, please get it. The other thing is it's going to be confusing. Do you have the flu or do you have the COVID virus? And if you haven't had the flu vaccine for this year, it's still available, although your risk is less. And who knows when we'll have a vaccine for this because of the mutations. And when we have the vaccine, it will not be 100%. This year's flu vaccine was 68% effective, but 68% is better than zero. So do remember that you still have other issues to protect yourself with. And if you have a pre-existing condition and you've been ignoring it, if you have asthma or COPD or heart disease, make sure when this is over, you make an appointment with your physician and you get as healthy as you can get, regardless of what's going on with you. And then you'll be better prepared.
Mary Beth, when you're talking about that, there's a pneumonia vaccine. Will that help as far as this COVID goes?
I don't think there's any specific information about it helping for COVID, but it's for a specific pneumonia bacteria. And it's very good to have that too if your doctor recommends it, and mostly they do. There are a few people they don't recommend it for various reasons, but any respiratory illness or potential respiratory illness that can be put into good shape is going to make a big difference on how you cope with anything like a virus. And don't try I presume you people are all intelligent enough not to try any treatments that are recommended by anyone other than a medical professional or the CDC or something like that.
Thank you, Mary Beth.
Most of this doesn't work.
Yes.
I heard something today that I will share on the news this morning. I have a neighbor actually who yesterday told me that he's convinced that this is perfectly fine for younger people to get, and he thinks they should all get it so that they build up the immunities, and that all of we older folks should stay home. But today on the news, there was an interesting report. It's very early in its stages, but that they've discovered that people in their 30s and 40s who do acquire this virus have a higher percentage of strokes. And I thought that was really interesting to note. This is not just affecting older people. So, I think we need to make sure our children and our grandchildren understand that they need to take the same precautions that we are.
Yeah, and if you have your children and grandchildren saying to you, "Oh, it's just the flu," it's not.
Yeah.
Younger people have died. There's one more risk factor I didn't mention, which tends to occur in younger people, and that is being fairly overweight. They say that's an important factor, and being inactive. But the reason for the strokes, and you might have seen some celebrity or another, I don't really know who it was, had a leg amputated. There is an illness called disseminated intravascular coagulation, or DIC. And people get this sometimes after childbirth or surgery or severe illness. It's where your body goes completely wacko on clotting. Sometimes you bleed, sometimes you clot. When people get this, it's very, very serious. I've heard about these problems with blood clots, and I think that they must be just people who got really, really sick and who got DIC. Also, younger people, whether they tell you the truth or not, they smoke marijuana, they smoke cigarettes, they vape, God help them. They ignore going to the doctor. And even if they're young and healthy and running every day, they are at risk. Absolutely. Plus, they can share it with us inadvertently. Oh,
Indeed.
oh,
Well,
I
you know what?
forgot
So
Sweden. One more thing. Sweden
sure.
did exactly what the last caller asked me about. They let everybody go. They put no barriers, and now they have huge numbers. They call it herd immunity. Sweden did it, and the Netherlands did it. And they thought if everybody got it and everybody who was at risk stayed home, it wouldn't happen. And now they're having a huge resurgence of cases. So that simply doesn't work.
Yeah. Well, this is all great information, and I know that we could be asking questions and leaning on Mary Beth's amazing experience and breadth of knowledge all day. And again, she has shared a number of different documents. I know with Reed that is going to be going out in the newsletter, so you want to make sure you're signed up for that over at the Bainbridge Island Senior Center website. But a huge thank you, Mary Beth. Thank you so much for being with us today.
Yeah, well, I'm a senior just like you, and I will enjoy the presentations that the rest of you will be giving and the interactions we'll eventually have in person. So nice to be here. Thanks again.
Thank you, Mary Beth.
Excellent.
Bye-bye.